Okay, this is Shanika Salter, and this is my video on asthma action plans. You guys have been explained about when you have an asthma attack, right? What happens when you have an asthma attack? Huh?
Get short of breath.
You get short of breath. Get short of breath. So what do you do when you have an asthma attack?
Take your inhaler.
Yes, you take your inhaler. Okay, what do you do once you've had an asthma attack and you're all better? Do you know what you do after that?
No.
No. Okay. Do you know what an asthma action plan is?
No. Yes.
Yes. You know what's the purpose of an asthma action plan?
No, I don't know.
You don't know. Okay, that's what I'm going to teach you guys today on how to properly use an asthma action plan. When you have an asthma action plan is a written plan for your asthma. It's what you should do at different stages, and it writes it out for you. So it starts out, there are 3 different sections to an asthma action plan. Most people are using the green, yellow, and red. They come in different forms, but basically all of them come in the green, yellow, and red section. And I'm going to flash you a picture of what this looks like. You get that one? That's one. This is another. And this is another. Let me see it. Okay. So in case you can't see it, this is a copy of an asthma action plan, a color asthma action plan. The provider usually fills this out, and anytime you have an asthma attack, or you go to the doctor and let's say anytime they change your asthma medication, and then you should at least get it updated once a year. Anytime any of those things happen, you should get a new asthma action plan, a written asthma action plan in your hand. Okay? The provider spills out like the medicine. First, at the very top, it tells you what your triggers are. Do you know what your triggers are? I'll show you. You know what your triggers are?
Yes.
What's your triggers?
Change of weather. Change of weather.
Change of weather, and what else have we found out it is? Grass.
Grass.
So every time you cut the grass,
Right.
you've got to hit your inhaler. Okay? What's your kids' triggers?
Cedar trees.
Mm-hmm.
Weather.
Weather.
Weather change. Mold.
Mold.
And
Okay. So at the top of your asthma action plan, your provider will put what your triggers are. It'll say asthma triggers, and then they'll spell those out for you. So those are the ones that you try to avoid. You try to avoid those things, or if you know you're going to be around those things, you try to prepare by using your inhaler ahead of time, right? So like if you know the weather's getting ready to change, you know you're going to have to change some meds or something, maybe give an increase on allergy medication, or if you know you're going to be around in the trees and grass, cedar and all that stuff, you take your inhaler before you go, okay? So they start at the top by spelling out what your triggers are so that it's written down and you know what you need to try to avoid. The green section is the section where if you're taking your daily medications, you're not having to use your inhaler, everything's good, that's the green section. That's the section you want to be in. The green section, it'll list your daily medications. It should always list your daily medications in that green section. It'll list your rescue inhaler also in that green section. It tells you what meds you are on and what meds you use for your rescue. All right? Your yellow section, which is the next section, it tells you, say you were exposed to those and you take your inhaler, you've taken your inhaler and you've done your waited 20 minutes, you have to take it again, and then you're all better. Your yellow section is the section where you've had to use your inhaler but not all the time. That's the yellow section. The yellow section also, like if you say you use your inhaler 3 times in a month, 2 to 3 times in a week, When you get in your yellow section and you're staying in your yellow section, that means you can't go a couple of days without using your inhaler. You need to schedule an appointment with your PCM. Because if you stay in the yellow section, there's something that needs to be changed. Something needs to be increased, something needs to be added. You've got to not stay in that yellow section. You don't want to stay in that yellow section. You want to be able to just take your daily medication and be okay. Okay? So your yellow section will list your what you're looking for. A lot of times it will spill out like first signs of colds, or you start to hear a little wheezing. So then you're taking your inhaler. All right? So after the yellow section, you go see your PCM. They change something, you get into asthma action plan. Okay? All right? Because they changed meds. Whether they change the dose, whether they change the actual medication, whether they change, the way you use your daily medications, anytime they change anything having to do with your asthma, your allergies, you need to get a new asthma action plan. Okay? That's regardless if you go, because I know you guys go to allergy. So if you go to allergy should give you a new asthma action plan. If they give you a new asthma action plan, you need to go to your primary care provider. You need to show them this is what I've got from allergy. This is the new asthma action plan type thing. Okay? If you go on post, they already know that information. But if you go off post allergy, then you'll have to take that. Okay? Red section. Red section is the section you want to avoid. Red section is the section where you've taken your inhaler, you've taken a couple of puffs, you've waited 20 minutes, you still feel like you can't breathe, you haven't stopped coughing, you take another 2 puffs. Still not feeling any better, you need to take a third one. When you get ready to take that third puff, you need to either be dialing 911 or you need to be headed to the ER. Okay? That is the danger section. That means your rescue inhaler ain't working. This is your rescue. So if it's not working, you got to get somewhere where you can get something that you don't buy at home. Okay? So the red section is the part where you go to the ER. If you go to the ER for any type of asthma, allergy-related type thing, you got to follow up with your PCM and what? Get a new asthma action plan. Because obviously what you're on is not working. The rescue inhaler is not something that you should have to use on a daily basis. If you're using that on a daily basis, you need something else. You need to be on something totally different. Okay? I noticed that they gave you peak flow meters.
Yes.
Okay, the object of the peak flow meter is you're supposed to do that when you're healthy so they can get an average of where your numbers are at. Once they get an average of where your numbers are at, that is also placed on your asthma action plan. Okay? So it'll tell you, like you could be, sometimes people don't realize that they're actually having asthma issues until they get to the point where they can't breathe. Right? So this peak flow meter will kind of give you an idea that, oh, I'm having some issues with my asthma type thing. So what they'll do is in the green section on the side here, that has an area for peak flow. And it gives you a number from and to, right? So it gives you a range. So it tells you what section. So if you're doing your peak flow meter, you could have, once your child does her peak flow meter average, you could just go to her when you see the weather starting to change, or if you're going to be somewhere, or if you just see that she's just don't seem very comfortable. Sometimes, like I noticed on O'Shea, I can tell her eyes get dark underneath. Zeandra's eyes get dark underneath. You know what I'm saying? I know that they're having some issues. Sometimes you can do the peak flow meter and you can tell which section she's falling into because it gives you a number range. And I think that's what your provider's trying to do, is trying to figure out what range she's in so that when she's having issues, she can use the peak flow meter and you can see which section you're in. Okay? So we went over what an asthma action plan is. When should you get an asthma action plan?
Every time you go to the emergency room, or every time you have any medicine change or something,
And also you should get it
once a year.
once a year. They say 6 to 12 months, but you could do once a year. Okay? And also, you say you know what an asthma action plan is for, you know how to use it through the different sections. So you understand the green, yellow, and red. Red means go to the ER.
Right.
Yellow means, okay, might need to go to the doctor. Green says go, you're good. Y'all have any questions? Y'all need, you understand?
I got it.
Because now an asthma action plan should be given to you. You should have one at home.
Okay.
Because you're not going to remember all this
No.
until you've done it a few times. So you should have one at home. You should have a couple of extras just because if you, let's say, you take the kids to grandma's, she needs one too.
Okay.
If they go, they have one for school, but you should also have one for yourself. Also, you have to explain to the teachers. If you have to, because that's where the issue comes in with the teachers. The teachers feel uncomfortable, so you have to talk to them and make them uncomfortable. The nurse in the nurse's office doesn't speak to the teacher, so they don't know. So a lot of times, if you at least give that asthma action plan to the teacher and sit down with the teacher and talk to her and go through the asthma action plan with her, maybe she'll understand a little bit better and maybe you won't get some. Everybody should know, even the kids. The kids, it's easier on the children if they know what their plan is, if they understand like their asthma. Like O'Shea knows exactly when she needs to go get her inhaler. She knows that, I'm going to cut the yard, and I nag her anyway, and I make sure she takes her inhaler. But Leandra, she a lot of times she's a work in progress. So, when you wake up and you can't breathe, you've got issues with your asthma. There's something going on there. If you're waking up in the middle of the night coughing in your sleep, you've got asthma. You got to use that asthma action plan. It's there written down for you so that you know when to call the doctor. They created it so that patients or parents won't be in the emergency rooms a lot. They're trying to prevent emergency room visits.
Right.
So if you know that you're in this yellow zone for a while, you need to go to the doctor because you don't want to end up in the ER. Okay. This is what they're trying to prevent you from going to the ER. So, or if your provider knows you enough, they can tell you. And the asthma action plan, it writes down, you can have 2 to 6 puffs when you're having issues, is what most of them say, or you can do 2 to 8. So you don't have to start with the 2. If you're really, really having issues, you can start with 8. And then you can cut it down after that if you're not getting any relief. So do you understand that?
So you can just puff all at once 8 times?
No. When you give an asthma puff, you got to give 1 puff, wait a whole minute in between, give puff number 2, wait a whole minute in between. What that does is that lets the particles of that alveolar inhaler get all the way deep down into your lungs, and then the more you do it, it covers the whole lung field. Also, a lot of times on the asthma action plan, they have in there where you can, like say you're in the yellow zone, and you're in the yellow zone for a couple of days, you just can't seem to get over it. It says in the asthma action plan to give 2 puffs every 4 hours for 3 to 4 days.
Okay.
So, like say O'Shea had a very, very bad asthma attack outside. She just couldn't get over it. And then for the rest of the day, she just kept having to try and use her inhaler. It wasn't like constant for over an hour, but she just couldn't, she still felt tight. She's still coughing and sneezing. Then she needs to take her inhaler every 4 hours for the next 3 days. Okay? And then, because what that does is that gives you your body time to stop the inflammatory process. Because that's the steroids you got.
Right.
And then with your daily meds. So make sure every 3 to 4 days, if you're having issues like that, like say Marcina has coughing and she's just coughing, you're giving her inhaler today, you got to give it again before she goes to bed, and then the next day you got to give it again. You need to just give it every 4 hours for the next 3 days.
Okay.
That helps her recuperate and get back to her normal self.
Okay.
All right? Any questions?
Thank you.